This is Chapter 10, Evaluation and Policy Analysis. A lot of times when we're looking at data that we can use, we really have to look into it and disseminate what we can really use, as well as the policies that are utilized to gain that data sets. This chapter really goes in pretty good detail what what uh, what is basic and applied research, and then a lot of the evaluations and questions that go into that type of research. So let's get started and see where we can get. So applied research is just research that has an impact on policy, and it can immediately be utilized and applied. It looks to find solutions for existing and specific problems. This research type uses empirical methodologies, such as experiments, to collect further data in an area of study. The evaluation research process is a variety of social programming evaluations. The evaluations research process, the different types of evaluation research, alternative approaches, and ethical concerns. When you look back at the history of evaluation research, you come that there are different types of evaluation research. The case studies that illustrate the various methodologies used to assess the different evaluation questions. Difference between basic science and applied research is the discussion of the differences between basic science and the research emerging demand for evidence-based policy. What can we do to do it? And this all kind of goes with uh, the explaining the differences of applied and basic research. How do they work? How do they go into how are we going to how are we going to use them for our research? There is a systematic application of social research processes. It's an evaluation research in this application and the procedures for assessing the conceptualization, the design, the implementation, and the utility of social intervention programs. What this does is it allows us to be able to track down and duplicate or apply the varying different applications. We have what they have investigates outcome, the impact of the program process on the cases processed. It's another terminology used to just say what has happened, how are we going to look at it. So these results must be understood and utilized by the practitioners. Professional researchers have to be responsible for making sure that their results can be understood and utilized by the practitioners to make decisions about scrapping or modifying existing programs. How are we looking at the testing portion of it versus the application of it, and the further application on other processes? Process of evaluation research requires those three things: inputs, program processes, outputs, and feedback. So inputs is just the resources, the raw materials, the clients, the staff that go into a program. Program processes is the complete treatment of services delivered by the program. The outputs are those services delivered or new products produced by the program process. And feedback is the information about services delivered, system outputs, outcomes, and operations that are available to any program inputs. When we look at the evaluation research and social science research, what are the differences? The difference, unlike explanatory social science research, evaluation research is not designed to test the implications of a social theory. The evaluation process as a whole and the feedback process in particular can be understood in relation to the interest and perspectives of program stakeholders. Stakeholders are just the individuals or groups who have some basis of concern or have a valued interest in the program. It's making sure that we follow a prescribed set. How are we looking forward? And how are we documenting everything going forward? Now, Your text does a pretty good job, and this is from Martin and Kettner, of a what they call the feedback loop sometimes, right? You have the inputs, you have the feedback from the outputs, and it all comes back to the stakeholders who give feedback, who then you reevaluate and retest the processes. Many times you'll see that research and theories and whatnot are cyclical in nature, to which they tend to keep rolling forward, hopefully forward. And this is no difference. In evaluations, you look at what you can do better and make from the you getting feedback from the stakeholders. You're changing the processes, and then you start the process all over again. The questions about evaluation. You really need to look at what you are trying to do. What's the evaluation of the need? Why are you trying to do it? Is there a compelling or um, 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 compelling need that you have to do this? The evaluability assessment. Can the program be evaluated? Can you realistically look at it and say if it was good or bad? The evaluation of the process. How does the program operate? Is it user friendly, for a term that we use? Is it very convoluted? Does it follow a, a, a natural flow of things? The evaluation of the impact. What is the impact of the program? How is it going to change what has currently been? Is there something that's going on now that needs to change for whatever reason? The evaluation of efficiency. How efficient is the program? Are we putting more in than what we're getting out of it? Those are some big questions that we have to answer or ask ourselves as they relate to the operation of a social program, and they impact what we do based on these evaluations. So we have to ask these questions going forward. So, do we need a program? That's the first thing that we need to look at. And the first thing that we usually do is a needs assessment. And this is just a type of evaluation research that attempts to determine the needs of some population that might be met with a social program. Like if we look at the ADRC about giving meals to or home delivery and meals to seniors. We've looked at the research that shows that their nutrition is woefully below where they need to be. They are on a limited, fixed, or subpar income to where they can't afford good meals. So we provide a program that delivers meals to the elderly who are infirmed or who can't get out. These could be the same as, say, meals for kids in school, hot breakfasts, or hot lunches, whatever it is, where it's looking at the only good, well-balanced meal that someone can have, be it due to social economical variables or influences, that this is going to be their one good meal that they get. So it's incumbent on developing a program to ensure that our kids, are looked after, cared for in the sense of having a good meal. So, applied research tools to provide reliable evidence. What shows that the kids or the elderly needed the this type of program? Evaluation researchers apply research tools to provide reliable information on the nature of the scope of the problem, as well as the target population in need of the intervention, i.e., the people who are getting the meals. Do they really need them? How does the program work to fulfill that need, and so on. Can the program be evaluated? That's one of the hard things when we have uh, certain programs. I'll continue on with the program that we're talking about, the meals for children or the elderly, how do we know that we're doing something beneficial? What's the data that supports it? And the first part is doing an evaluation, an evaluability assessment, which is a type of evaluation research conducted to determine whether it is feasible to evaluate a program's effects within the available time and resources. How are you going to determine what it is? And over how long of a period are you going to do it? So, what resources are you going to have? Say in for the kids' meals, they do the schools already have facilities to do well-balanced meals? To do the seniors, where are the meals being prepped, and how are they going to get to their houses or apartments or wherever there is? So what kind of resources do you have? What kind of time do you have to get it to them? Then you have what they call action research. Researchers use qualitative data like in-depth interviews and program managers, key staff, and program sponsors. What they do is they put people out into the quote unquote field, and they're asking key questions. What kind of meals are you getting per day? What kind of money do you spend on food versus heat or rent or whatever? What kind of weekly groceries do you have? And then what this does is it encourages changes in program operations because they may be lacking in one area, but they're good in another. So they present the findings to program managers and encourage changes in program operations. So we know that they're deficient in one area or not. And then we can kind of tweak that going forward to ensure that they are getting the nutrition that is needed from them. Next is the program working as planned? What is the process evaluation? You know, we're looking at monitoring the program to see if an evaluation research that investigates the process of service delivery. What is happening? Is there a noticeable change? When assessing program coverage, it consists of estimating the extent to which a program is reaching its intended target population. Are we hitting the demographics that we're doing? Are we making enough to make an impact? Program coverage can be monitored through program records, surveys, the number of utilizers versus dropouts or ineligibilities. If people say kids either age out or their finance changes at home to where they are now able to get more meals, they withdraw from the program. Does that make a difference? Same thing with the elderly. If they, unfortunately, when they're elderly, if they pass away, how does that work? Was it due to poor nutrition? Is it due to something else? How are we looking at things? And it goes to the evaluation program. It consists of measuring the degree of congruence between the plan for providing services and treatment and the ways that they are actually provided. Um, it can be monitored through survey records, management information, the report by program recipients. How is it going to be evaluated? Yes, it's going to be positive. Normally it's going to be positive in the example that I'm giving. But what is really happening going forward? Is it that they are now working to do something else, or are they seeing how important nutrition is and they're changing their habits to go and make it a priority versus something else? In the case study that was given, it talked about the evaluation of the CAGI. I can't remember what that is. Mm, I know it's a deals with gang. I don't know if it's California. I can't remember what it is. Um, it's a It was a process and impact evaluation of this initiative, where McGarrell and his colleagues conducted both a process of impact evaluation and the CAGI initiative. The process of evaluation components of the study were that the components of the project with the CAGI project coordinators in all sites along with site visits and interviews with federal partners coordinating with this measure. The measure they tried to accurately measure the degree to which various components of this program were being implemented, and the survey asked site coordinators regarding, the rigors of the research, commitment to law enforcement strategies, the diversity and range of the prevention strategies that were adopted, and it looked at, how it really worked. And it's difficult to measure because you have people who are being either observed or a program that's um, with someone for a period of time, and then the rest of their time is with something, involved in something else. So that really kind of makes a process that's hard to say if it's doing what you want it to do. Did the program work? Well, the implementation of the program has been delivered to a target population as planned. The next role for the evaluator is to conduct an impact evaluation. That impact evaluation is just the analysis of the extent by which the treatment or other services intended did it reach its intended effect. The goal of impact evaluation is to achieve a fair, unbiased test of the program itself so that the judgment about the program impact is not influenced by the differences between the types of people who are in the different groups. The program impact may also be evaluated with quasi-experimental designs or surveys in field research methods without a randomization experimental design, meaning you could go right to those individuals and see what happened. Did the program make any difference on your trajectory? Did it do anything that dissuaded you, or did it help you want to get out of that particular life and do something else? So it has a a process. They were talking about the quasi or the randomization experiment design. We had talked about that last week or the week before, and how you looked at more of a scattered approach versus a focused, narrow, directed approach. And with these types of programs, because they are individually based, I would probably go with not using the randomization, only if it was a program that was utilized more nationally than locally. Something like the DARE program, which is the risk skills training program, and the drug abuse resistance education, which is the DARE. I've seen this in action. I've seen it. Uh, there's a school that is, or I should say, a program that put on by law enforcement. It does go into the schools at varying levels, and they talk about the different challenges that are going to be faced by children growing up, drugs and alcohol and whatnot. They do it in it's not a very sterile type. It's a lot more games and a lot more geared for kids so that they're learning and while not knowing that they're being taught something. So then that leads us to the impact evaluation, alcohol expectancies. The department, dependent variable examined included positive, negative alcohol expectancies, the anticipated effects of drinking, as well as the perceptions of peer risk taking and actual alcohol consumption. They went back and looked at how, those who had taken the DARE program in third, fourth, fifth grade, and they come back to those who are in high school, and they ask pretty much the same question, topical questions of how did it Did it really work? Did it deter you? Was it something that you actually thought about, or because it was so long ago, it was just kind of gone? Then we have the is the program worth it? Efficiency analysis is the type of evaluation research that compares program costs to the program effects, dollars to hours type of thing. How much was spent to change a particular habit or influence something in that way? It can be either a cost benefit analysis or a cost effectiveness analysis. You can call it one of two things. Either way, they're looking at the comparison between the financial records or the financial money spent versus in comparison to the change, the anticipated change that you were trying to do. That's one of the reasons why the DARE program really hasn't done too much. There was a little bit, it started on an uptick for being valued, and then over time, it just kind of plateaued and then eventually dropped out from that. A cost benefit analysis is a type of evaluation research that compares costs to the economic value of the program benefits versus the cost effectiveness, which compares the program cost to the actual program outcomes. So, how much were we spending for DARE compared to how much are we saving in locking people up, or the amount of time spent um, processing them if they've committed a violation of law, those types of things. So you need to make sure that you're looking at both analysis as far as which one you want to highlight as far as your particular study. The closed circuit TV, the cost benefit analysis and monitoring and direct patrol. This was a study program used to pair proactive TV monitoring with direct police patrol, which is called CCTV directed patrol strategy. This is be very similar to um, lights on traffic lights, yeah, cameras on traffic lights, or if you go down to Chicago, you're going through the tolls, right? You have it. If your car goes through and doesn't pay the toll, you get cented for that, right? They created a new effect, which is the T&E, total net effect, which estimates the crime prevented or generated by CCTV TV directed patrol strategies, how many crimes in a particular area that they were looking at occur over annually. Then they put the cameras in, and they're able to more accurately get suspects and make arrests. What were the results? Their estimates included several different costs, including victim costs, criminal justice system costs, policing costs, court and corrections. So the victim costs of the healthcare, if they were assaulted, they had to go to the ER, or the insurance portion of it to replace the criminal justice costs of putting people out there, which would include the policing and court costs. If they did find the suspect and take him into custody, the corrections cost of it. The result is it's a not cost effective. The directed patrol strategy increased the cost effectiveness of the CCTV system. However, investing in new program system could lead or would lead to a more cost deficit. They still utilize parts of this program, like I said, for uh, handing out traffic tickets and stuff like that. But as far as crime, they tend not to utilize it as much. So then we have to have decisions on how to design a specific evaluation project. So they have what they call the black box or program theory. What this is, it describes um, I should say the whole thing evaluation project goes into three areas. The black box or program theory. Do we care how the program gets results? Um, is it one of those uh, the benefits outweigh the cost types of things? Researchers or stakeholders and orientation, who goals matters the most? Are we really looking at the generation of data, or are we looking at the reduction in crime? And then the third is the quantitative or qualitative method. Which method provides the best answers to the questions that we're looking for or posing? And this goes back to um, what we're talking about as far as um, the way that we want to measure our data. So one of the things about the black box theory is the black box evaluation. This type of evaluation occurs when an evaluation of a program outcomes ignores or does not identify with the process by which the program produced the effect. There's a program theory, a descriptive or presumptive model of how a program operates and produces its effects, as well as the theory-driven evaluation, which is an evaluation that is guided by an over encompassing theory that specifies the process by which the program has an effect. I've never had to really endure a lot of these types of things before. It depends, like I said, a lot of this goes into a lot of details versus in some types of the researches that you may never even have to go into. But it would be disingenuous not to give you the ideas of these, because it discusses the role of program theory and its value in uh, evaluation research. And this whole black box things is to just understand the concept of it. But you may never use it, but you should still kind of have a point of reference to it. The researcher or stakeholders orientation. The first evaluator of the evaluation research is therefore the funding agency, not the professional social science community. It's the person who's signing the checks, not for who the project is for. Evaluation research is research for a client. It's usually direct at a direction, not necessarily a self-initiated program. And its results may directly affect the services that the program users receive, depending on if the person that contracted it is not happy with the cost effectiveness of it or cost benefit with it, they may withhold it or not, right? Withhold funds. A shareholder approach, it utilizes focused evaluation, action research, and the appreciative inquiry. The utilization focus, it's the evaluator forms a task force and program stakeholders who help share the evaluation project so that they are more likely to utilize its results. The action research program participants are engaged in the research as co-researchers and help to design, conduct, and report the research. And the print, that can't say the name words. The last one eliminates professional research altogether in favor of structured dialogue about needed changes among the program participants themselves. This takes us to researchers or stakeholders orientation. What this is meant to do is it looks at the social science and integrated approach. So the social science approach and researcher expertise is an orientation to evaluation research that expects researchers to emphasize the importance of researcher expertise and maintains of autonomy and program stakeholders. Evaluators who adopt this approach derive a program theory from information they obtain on how the program operates, and an extent social science theory and knowledge, not form the views of the stakeholders. Where the integrated approach, stakeholders and it goes to an orientation of evaluation research that expects researchers to respond to concerns of people involved with stakeholders, as well as the standards and goals of the social scientific community. We're looking at two different perspectives. One is that those who are going to benefit from it, those who are leaning towards it and driving the programs, the research. This takes us to our case study, another one in the reading, which was the problem-oriented policing in violent crime areas and a randomized control experiment. Used random assignment, a procedure by which experimental and control group subjects are placed into groups randomly. In this study, 56 neighborhoods were matched into 28 pairs of equal levels of crime, uh, which were then randomly assigned to receive the problem-oriented policing treatment. If you are not aware of that, basically what happens is when a neighborhood is designated as a POP, what they're doing is they're dedicating officers to a specific area, communities, whatever, and those officers will work there every day rather than a rotating of territories. The hopes is that they can see the crime or the whatever the issue is over time, and then work with the community themselves to help rid it. It could be, say, a drug house or some type of bad element that's moved in, or say, if you want to use the broken windows theory, um, they need to clean up the cars because the abandoned cars that are all around because it's giving a bad view. So law enforcement works with the community and tries to solve individual cases with it. This particular time that they use just random areas of putting people in, not necessarily what was the most deserving of the programs. The program examined the efficiency of problem-oriented policing. It The number of specific tactics that were implemented by law enforcement to control the physical and social disorder at experimental violent places. Control places did not receive these problem-solving efforts. They received traditional policing strategies of, routine patrol going through the neighborhoods. You did have different officers rotating through on shifts. The results indicated that the problem-solving police strategies examined in the evaluation research have or appear to have had a great deal of success in controlling and preventing crime wherever those people were that had a positive effect. Next, we have our strengths of randomization, true experimental design, and causational relationship. It's the data obtained from true experimental design is the best way to determine that all criteria establish a causal relationship between variables and have met such things as the association between independent and dependent variables, a correct time order, meaning the independent variables precede the dependent, the non-sporadicness or the rule of influence that over other variables. And it talked about the random assignment being unambiguous, meaning that the random assignment of the communities to either the problem-oriented or traditional police conditions controlled for a host of possible extraneous influences that may have created those spurious relationships. Several groups increased in the generalization ability of it. The study used several experiments and control communities. These increased the likelihood that their findings and generalizable to their respective populations. I hate when they use Big words that I can't say. All right. So, quasi-experimental design, it kind of was mentioned before, is a research design in which there is a comparison group that is comparable to the experimental group in critical ways, but subjects are not randomly assigned to the comparison and experimental groups. Um, it lacks random assignment in the evaluation using this quasi approach. The element that is often missing is random assignment to experimental and control conditions. So it makes it hard to say that it was truly happening regardless. The program is beyond control of the evaluator. The primary reason why randomization is likely not possible in evaluation research is that the program is usually outside the control of the evaluator, because once you start it, you have to just let it go and it becomes its own entity then, and it works on its own. The difficulty is cooperating with the program staff and the sponsors in obtaining the cooperation of the program staff and the sponsors is often an obstacle in evaluating research. So that in and of itself makes it difficult, and why sometimes it's not utilized as much, because it's trying to get the information back is difficult. So it's not really used that much. This leads us to the case study of non-equivalent control group design, or decreasing injuries from police use of force. Um, in this, they were looking at different effects. The injury rate, Taylor and Woods compared injury rates of both officers and suspects that were used in this CED with a matchup sample of that did not use them. The non-equivalent control group design um, was looked at as a quasi-experimental design in which there are experimental and comparison groups that are designated before the treatment occurred, but not are created by random assignment. They compared injuries of the when we do use of force in law enforcement, what happens is every time that you send a report, there's usually a form that goes into as far as what force was used. Was it just voice? Was it presence? Was it the use of chemical, which is, spray? Canine? Was there an impact weapon? Was there physical uh, force used? And you check them all off. And what the researchers did is they've gone to these departments and they looked at all of those forms through the Freedom of Information Act that we talked about a couple chapters ago. And by documenting the uses of force, it also has in there the results, if there was injuries to the suspect or the officer and what those were, and the treatment for it. Uh, that kind of goes into the keeping the identities confidential. Um, but what they did is it was an analysis that suggested that CED, uh, uh, the availability of it to officers is a key factor in reducing injuries to the officers and suspects by the use of such practices. Our next one, let's see, is the qualitative and quantitative methods. We've talked about this before. The quantitative methods compares outcomes. It's used in the evaluation research that attempts to identify the effects of treatment, law, or the program. When there is an interest in comparing outcomes between an experimental and control group or tracking changes over time in a systematic manner, quantitative methods are favored versus the qualitative. The qualitative methods provide more depth, detail, nuance, and exemplary case studies. They allow investigating the program process and help in learning how different individuals react to treatment. They help in understanding how social programs actually operate. Um, the relevance to the policymakers and sponsors is how you're going to utilize the methodology selected for evaluation of a project, and it should be relevant to the policymakers and planners who intend to use the results. So you have to look at it from not only a what am I looking for, but if we're looking at creating policy based on it, how are they going to be able to utilize it as well? Increased demand for evidence-based policing or policy. Policy research and empirical evidence is a process in which researchers results are used to provide policy actors with recommendations for actions that are based on empirical evidence and careful reasoning. Meaning, if we are going to change a policy, we need to support it with data. And that data comes from experimentations. That experimentations will either support the policy, support change for the policy, or the policy may need to be abandoned. Evidence-based policy is what they call a rigorous design, the policy that has been evaluated with methodological rigorous design and has been proven to be effective over time. You're not utilizing new processes, new applications. You can use those, but you still have to use the old ones to show that there is some standardization ability of it, so that because it's a scientific process, it has to be replicatable, it has to be defendable, and whatnot. The systematic review of the meta-analysis is the summary review about the impact of the program, where the analysis attempts to account for the differences across research designs and samples, often using statistical research such as meta-analysis. This would be more in line with the quantitative data versus the qualitative. And then you have what they we were talking about, the Campbell collaboration, which is a group producing systematic reviews of programs and policies in many areas, including criminal justice, social work, and education. And which brings us to our last point, which is the human subjects considerations. Evaluation researchers need to consider human subjects' concerns. We've talked about this before. People's lives. The evaluation researchers can make a difference in people's lives while it is in progress, as well as after the results are reported. Research participants and their families may have a direct impact on the researchers' participants and potentially their families, heighten the attention that the evaluation researchers have to give to human subjects is of a concern. Concerns with random assignments should be a focus of research when evaluation of a program impacts human subjects considerations. Random assignments is reasonable when a new program is being tested. However, random assignments for an ongoing program means that not everyone in the population who is eligible for the program can receive it. So, to sum up this this chapter, we were looking at how things are evaluated, what are the central processes that we are looking at. The questions that we have to look at are what were they? Do we need the program, right? Do we can the program be evaluated? If the program is working, is the program working as planned through that evaluation? At the end, did the program work? Did we get the results that we were hoping for? Is the program worth doing? Is it an idea of cost benefit analysis or cost effectiveness? Is it truly a dollars for hours or dollars for whatever the results we are looking at? That pretty much summarizes chapter 10. If you'll notice, some of these chapters at the end are a little briefer because they are looking at things a little bit more holistically rather than in depth. If there's any questions on anything, please give me, if I'm your instructor, an email. Let me know how I can help you. Otherwise, get a hold of whoever is conducting these courses, and you'll be good to go. Until next time, I will see you. All right, I guess you'll hear me about Chapter 11. Talk at you then.